Now here we can see this is MR angiography image. This is MRI and this is basically an angiography image. Now what we can see here is if we see in this or we zoom into this, the normal anatomical structure that we must know is that this is anterior cerebral artery. This is anterior communicating artery because these two arteries communicate. This is the left-sided middle cerebral artery. This is left middle cerebral artery, and these are the all branches which supplies to some portion of the frontal uh, lobe, some portion to parietal lobe, some portion to temporal lobe, and it goes up to the occipital lobe. So this is the supply area of this left middle cerebral artery. We must know that this is the largest artery which we can see. This is internal carotid artery. Now this is the internal carotid artery, and this internal carotid artery actually gives this anterior cerebral artery posterior communicating artery. Now this posterior communicating artery basically connects this PCA. So this middle cerebral artery, anterior cerebral artery, these are the main branches which are given up by the internal carotid artery. So this is internal carotid artery. Now if you see, this internal carotid artery is completely missing out here. It is not there. It should have been here like this, but it is not there. It means ki there is complete thrombosis of internal carotid artery. We are not able to see this right middle cerebral artery, which was supposed to be here, which was supposed to have so many branches. As this artery is completely thrombosed, there is no flow through this right middle cerebral artery. Now, we must know that this is a portion of anterior cerebral artery. So there must be some portion of this anterior cerebral artery which is also completely thrombosed. This is a part of the posterior communicating artery which completes the circle of Willis. So this portion is also thrombosed. So in short, this internal carotid artery is thrombosed, and the anterior cerebral artery, they are not very visualized. The posterior communicating artery, the right middle cerebral artery is not very well visualized. If you can see, you can see so many blood vessels out here, but here it is not at all there because this portion of ICA is completely thrombosed. So this type of stroke will be always very, very large. This will involve extensive part of frontal lobe, parietal lobe, temporal lobe. It will also involve the white matter. It will also involve the caudate lobe or basal ganglia, putamen, and globus pallidus. So these many structures will be extensively involved in this much of large internal carotid artery uh, thrombosis. Thank you for today.